Okay, so we are trained to have a plan B so that we are not caught flat-footed. In any eventuality, we could always go to another plan or ask for help from other anesthesiologists here.
Credentialing and privileging in the medical city and the Department of Anesthesiology in particular follow a very stringent process to the end that each of the members of the department can administer anesthesia under similar conditions and standards.
At the end of the procedure, it is the job of the anesthesiologist to wake the patient or to take him off the anesthesia, a process called emergence from anesthesia. This we will tackle when we return.
Hi, welcome back to New Awakenings. I'm Dr. Finina Angeles Quintos from the Department of Anesthesiology of the Medical City. After the operation, it is the anesthesiologist's job to wake a patient up or to take him off anesthesia. This is a process called emergence from anesthesia. The patient is then brought out of the operating room and into the recovery room. Here, the anesthesiologist continues to monitor the patient until he or she is completely off anesthesia.
The post-anesthesia care unit is the recovery room. It's where the patients stay after each surgery. And here they are allowed to fully recover from the effects of anesthesia. In this room, they will be closely monitored by our skilled nursing staff, and also there's anesthesiologist consultant always available if there are some cases of emergency.
If the patient is a child or an infant, the anesthesiologist makes sure that the child wakes up in the presence of familiar faces, like parents, relatives, yayas, or guardians.
Okay, children usually, they're afraid of being alone or being with strangers. So in the recovery room, we usually have a yaya with them, or we allow the parents or the yaya to be with them so that when they're emerging from anesthesia, they won't be that scared.
Now, since safety is our foremost priority, it is our utmost concern that we monitor you continually and assess you while waiting for you to fully regain your consciousness.
The third edition of the Joint Commission on Accreditation has come up with a new standard, that of anesthesia and surgical care. In the medical city, standard of care for anesthesia services are observed. Continuous quality improvement is achieved by monitoring the activities of each staff member and recommending changes when these are required. In the Department of Anesthesia, patient safety is foremost in our thoughts, in our hearts, and in the way we behave.
One major concern of patients is whether the anesthesia will have long-term effects on them. Of course, as with any drug, there may be side effects, but these are usually just temporary and will have no long-term effect on a patient's well-being. Another concern among patients, especially for those undergoing general anesthesia, is whether they will wake up after the surgery and how long it will take for them to regain consciousness.
With the advent of newer drugs that we use today, patients recover from the anesthesia faster after surgery.
Another side effect patients may worry about is the possibility of memory loss.
Ito ang pinakamalimit o madalas na tanungin ng mga pasyente namin tungkol sa anesthesia. Dok, magiging makalimutin ba ako pagkatapos ng anesthesia? These are just myths about anesthesia. Itong mga gamot na ito will not affect their immediate past or long-term memory. So dapat wag silang mabahala na itong mga gamot na ito may permanenteng epekto sa kanila, sa kanilang memorya. Wala po yun.
Still, others may be concerned about regaining control of their limbs and extremities. or perhaps the impairment of cognitive functions.
Sabi niya sa akin na after surgery, I might not be able to move my legs, but it will return after. Guess what?
So eventually, the patient, when he goes into the recovery room, will gradually regain his motor functions. And that is why we let them stay in the recovery room until such a time that they have full control of their extremities.
Cognitive functions immediately after anesthesia may be impaired due to the residual effects of the anesthetics that we gave them. For this reason, patients who are given anesthesia are monitored in the recovery room until they are fully awake. And there is no long-term cognitive impairment due to the anesthetics that we give.
Patients often experience drowsiness and minor after effects following anesthesia. This includes muscle aches, sore throat, and occasional dizziness or headaches. Nausea may also be present, but vomiting is less common. These side effects usually decline rapidly in the hours following surgery, but it may take several days before they are gone.
In some situations, post-operative pain and discomfort become difficult to manage, and in cases like these, the patient is referred to the pain management clinic.
My surgery was successful, but I still had some considerable pain. I told my doctor about it, and he referred me to the hospital's pain management center.
Yes, pain management is one of the subspecialty of anesthesiology, and the anesthesiologist has to take up fellowship and further study in pain medicine before he can become a pain specialist. We have a pain management clinic here in the medical city which manages all kinds of pain. The aim with therapy is to decrease the frequency and severity of the pain and then to have a general sense of well-being, increased level of activity, return to work early, and of course, decreased cost of healthcare.
There are basically two major types of pain managed by the pain clinic. First is the acute pain, which is a normal response to our painful stimuli that is usually associated with trauma, surgery, or acute illness. This also usually disappears within days or weeks. Examples would be post-operative pain, labor pain, or pain from trauma. The second would be chronic pain, a pain that persists beyond the expected period of healing. Examples would be post-herpetic neuralgia, trigeminal neuralgia, chronic low back pain, and cancer pain, to name a few.
The approaches to pain management here in the medical city address both acute pain and chronic pain. For the acute pain, we have the PCA, or the patient-controlled analgesia, which can either be intravenous or epidural.
This machine allows the patient to administer small amount of analgesic by demand. It can be also programmed into a continuous infusion for better pain control.
For chronic pain, we use a multidisciplinary approach, and this is done by combining pharmacologic management with interventional techniques like the nerve blocks and radiofrequency ablation. This can also be coupled with non-medical modalities like the physical therapy, counseling, patient education, and some relaxation techniques.
With thorough pre-op visits, the safety and effectiveness of anesthesia during surgery is increased, and the chances of full recovery become higher. Patients recover faster and are sent home earlier.
Both written and verbal instructions are given to the patients. Although we give specific instructions from the surgeon and the anesthesiologist, general precautions are given to the patients, like they are not allowed to drive or operate dangerous machinery within 24 hours. Do not take non-prescription drugs or drink alcoholic beverages. And of course, do not make important decisions. As long as the vital signs are stable, meaning the blood pressure, respiratory rate, heart rate, and temperature are stable, then the patients may go home or be sent back to their room.
For the past few minutes, we've gone through the whole anesthesia process, from what happens before, during, and after surgery. We debunked the most common myths and misconceptions about anesthesia. And we learned what anesthesiologists do and the important roles they play in and out of the operating room. And perhaps most importantly, we hope that this program has helped you to better understand anesthesia, so that if the time comes when you do require the services of the anesthesiologist, you'll be a lot less anxious, a lot less worried, and hopefully your experience will be pain-free. This has been Dr. Finina Angeles Quintos for the Department of Anesthesiology of the Medical City, where patients are partners.